Good morning. I'd like to thank the Chamber for inviting me to share with you all this morning about a topic that often lacks popularity, and that is opioid use and overdose. As Jim said, I coordinate the local opioid safety coalition, which is housed out of County Behavioral Health in our Prevention and Outreach Division. The coalition started back in 2016 with a goal of addressing local opioid use from general community prevention to harm reduction, treatment, and hopefully recovery. So I imagine many of you have heard news stories about the national opioid crisis, fentanyl, overprescribing of prescription pain medications, COVID's impact on substance use and overdoses. And while it's true this is an issue that's affecting communities across our state and our nation, I really want to focus on what it looks like here in our community. So in 2020, we lost 88 lives to overdose. About 2/3 of those total overdose deaths were opioid related. Now with a county population of almost 300,000 people, 88 might not sound like a huge number, but consider that our overdose deaths doubled in 4 years, from 2016 to 2020, and fentanyl-related overdose deaths nearly quadrupled in 1 year, from 2019 to 2020. And so while we don't have enough data yet to know what that trajectory over time looks like, I can tell you anecdotally we're seeing more and more fentanyl, both on its own and mixed in other illicit substances like methamphetamine, heroin, counterfeit pills. So fentanyl's been in the news a lot recently for those reasons. So I wanted to give you a quick rundown on what it is and why it's so concerning. Fentanyl is a synthetic opioid, which means it's fully produced in a lab by a number of different chemicals. Fentanyl is at least 50 times more potent than heroin, and it's more condensed as well. So it takes very little to make a big impact. So combine this idea that a little fentanyl goes a long way with the fact that it is very cheap and relatively easy to manufacture, and you can see why it's quickly infiltrating the whole illicit drug market. Fentanyl's impact on the local drug supply seems to be affecting community members in the under 40 age group the most. When we look at the age breakdown of opioid-related overdose deaths just in 2020, we see a fairly even age distribution of the non-fentanyl opioid-related deaths. These are people mostly ranging from 25 to 65 years old, and not kind of a huge spike in any of those groups. But when we look at the fentanyl-involved opioid deaths, there's a much higher concentration of deaths, particularly for those who are 20 to 29 years old, and that they're really much higher than any other age group, which is super concerning that these are young people that we're losing to this disease. Other demographic trends locally are showing males affected at a much higher rate than females, and whites have a higher death rate than the county's average. Sometimes when we look at the race and ethnicity demographics, it gets a little bit skewed just because we have kind of smaller numbers, but traditionally whites are higher, and then in other years it kind of alternates between Hispanic, Latino, and blacks. So what can we do about it? Before we can tackle the effects of substance use, I want to take a minute to talk briefly about the disease of addiction. This idea of addiction as a disease, a medical issue, tends to be a roadblock in successfully combating substance use in communities. Many times we fall into this idea that addiction is a choice, and the solution then is naturally to choose not to use. So of course, when a person does initially make the choice to consume substances, that's a choice. Each time after that, it becomes less of a choice and more of a necessity. So when somebody uses a drug, it activates receptors in the brain and dopamine is released. Dopamine is super important to all of us as it's really what motivates all of our behavior, makes us feel good, etc. The problem with drugs is that unnatural levels of dopamine are released into the brain, and over time, that disrupts the brain's ability to maintain normal levels. And then they start to go down and down and down, even with the same behaviors, the same amount of drugs, etc. And so when people lack dopamine, our bodies crave it and sends us into survival mode. And that's why we see this whole host of unwanted behaviors like stealing from loved ones or continuing to use despite losing a job or your family, a home, all of the things that we kind of think of when we think of what that addiction looks like. So thinking of substance use from this perspective of looking at the behaviors as a symptom of a disease helps us better understand what barriers to treatment look like so we can truly meet people where they're at to get them help. So for all of us, this might look like encouraging our community to learn about and carry naloxone, the medication that can reverse an opioid overdose, or maybe offering support to a loved one who's thinking about treatment by helping them figure out transportation to their appointments or figuring out this mountain of paperwork that they have to figure out to get into treatment. As an employer, maybe this looks like supporting somebody with a flexible schedule or having resources and information available to employees about local services. It can simply be advocating for more availability of local treatment and recovery services. Our county provides excellent care, but we simply lack the number of providers to meet the needs of the community. So the problem of substance use is a big one to tackle, but taking a community approach based in empathy, even seemingly small steps can make a big difference in the end. Thank you so much for your time.